Okay, thank you. There have been a few more comments in the chat, and I'll just read one of these out from Kim. Important message about the Council of the Elders, how to ensure that the voices of people with cognitive communication difficulties also get heard. Many of those people won't be able to read information about applying for such a role, let alone be able to participate without appropriate support. This is a high number of people in aged care. Speaking only to carers is not okay. Thanks for raising this, Professor Joe. And with that, what I might do is move now into the panel Q&A section of the forum. And in this part of the forum, we've invited some people, consumers, to contribute to the discussion about the final report and looking forward. Before introducing them, I just wanted to make a few points to give some further context for this part of the discussion. 1.3 million people access the Australian aged care system. 184,000 people live in aged care homes, sometimes called residential aged care facilities. 142,500 older Australians receive a home care package. Over 50% of older people accessing aged care have one or more attributes that place them in a diverse or marginalised needs grouping, such as being from a culturally and linguistically diverse background, living with a disability, or being from the LGBTIQ community. 16% of people in that group of the number of people seeking aged care were homeless at the age of 55 years of age. And 70% of people in Australia with dementia lived in the community in 2016. From this data, it's important to recognise that in all of this, and the previous two speakers have also raised this, the voices of older people and consumers are very important. COTA Victoria has set up this panel discussion to provide an opportunity to hear from those most affected. We hope that there are more opportunities in the future to hear their voices. So let me introduce the panel members to you. Nicholau comes from a Macedonian background, and his mother was in St. Basil's until she died some years ago before COVID. During his mother's residency, Nick visited every day for 5 years before her death and interacted with other residents. Nick also speaks Greek. Robin Boat lives in Preston and has been involved in aged care through her life as a provider in policy development, project management, and is currently a fierce advocate. Peter Wilcox has a lived experience of disability since he was 4 years old. He worked in a small to medium business management before his retirement. He also has an extensive volunteer history in aged care and disability. He's a passionate advocate for people to maintain their independence and have the right to make their own decisions and choices. Karen Ivanka has worked in various programs and projects to support older people's rights and independence. She currently coordinates the Aged Care Navigators program at COTA Victoria and has worked at COTA Victoria for 18 years. And finally, Ruth Hosking is a home care recipient, Aged Care Navigators volunteer, lobbyist, and carer partner of her husband, who is a World War II veteran. Ruth lives in Bendigo, and during the recent COVID crisis, she made herself available on the telephone to assist people navigating the aged care system. Before we begin with the panel, I'd like to also tender an apology from Merle Mitchell, who can't attend today because of illness. Merle is an aged care home resident in Glen Waverley and has had former roles with the Australian and Victorian Council of Social Services. Merle was a powerful witness at the Royal Commission hearings. Her submission can be viewed on the Commission's website. We wish her well. Okay, again, just a reminder that during the discussion, you can make comments or questions in the chat. From time to time, we'll be looking at those comments and giving a summary or asking questions of the panel. To open with, What I'd like to do is ask each of the panel members briefly, if they can, within your personal context or role, can you identify one aspect of the Royal Commission's final report that will lead to better outcomes for older people? Who would like to start? Nick. Might just take you off mute, Nick. There you go.
Okay, yeah, good. A most pressing issue for me has been chemical restraint. And if staff numbers, and I'm certain that chemical restraint with over medication was used to deal with understaffing. I'm sorry, and increasing the numbers of staff in a manner where people, instead of being over medicated to be kept quiet, they would be taken for a walk during the day, on a nice day at least, that it's not raining. I often visited the nursing home that my mother was in, and I would ask people on a brilliant sunny day, did you go for a walk today? And they would always say to me, no, we don't go for walks. They just sat by the television with an appearance of a hangover on their face. And it was all too obvious that they been over-medicated. And of course, the other familiar feature of their being was the exceptionally loud volume on the television that they all sitting around, which was designed to drown any requests for help. So for me, if I had to single out one item that I think will make a difference with an increase in staffing numbers, would be chemical restraint.
Great, thanks very much, Nick. I think that's very important, and certainly the Commission has looked at the workforce, not only just in the training of the workforce or upskilling of the workforce, but also the staff to resident ratios. Any of the other panel members, it's very difficult for me to see on the screen, but just yell out if the panel members are there and want to make a comment.
Peter Wilcox.
Peter Wilcox, yeah.
Yeah, I live with disabilities, and we've got the two things happening concurrently. I'm a power chair user, and I live in a fully accessible home, and the one thing that I think has been addressed and recognised is that we need to provide better assistance for people in their homes. I don't think the modelling that I'm hearing is what I'm looking for, because I meant to grab this before, but I've got a lever arch folder that thick, which is a paperwork from my service provider for this year alone. Now, it's overwhelming. I'm still alert enough to be able to comprehend this, but to negotiate it is incredibly hard. I know that my partner would struggle with it. I know that my children would tick a box rather than try and understand what's happening here. And that concerns me immensely. So, but the one thing that I would say that's come out of this Royal Commission, and it's happening now, which is great, is that we're aware that we've got a system that is wrong, it is broken, it is cruel, it has not been addressed, and these recommendations are not going to happen. So we need to do something about it. I was involved with the Productivity Commission into Disability. I saw the NDIS start. I saw it driven by David Bowen, and I saw the energy that David put into ensuring that people were heard and things happened. We need no less than that. I don't know how we're going to get it, but we do need a senior executive driving this and driving it well with passion. Without it, we're going to end up in exactly the same situation we are.
Yeah, okay, thanks, Peter. Ruth or Robin, do you have anything to say? Ruth,
Ruth's
just
putting
take
up.
yourself off. If you can just turn your mic. Thanks, Ruth.
While I'm living in a regional centre now, I have lived in remote and rural areas, but I believe we need funding also for people in remote areas, especially who need to travel to appointments and travel to see their loved ones. And I'm very keen to see a council of the elders established, not only at national level, but at regional level, so
Yes.
that we can all contribute to this Council of Elders, because I've been involved in it in the school parent movement when the children were younger, and it worked.
Yes.
And so I'm hoping in my lifetime that we see the Council of Elders with regional contributions being made from
Yes.
all regions in Australia.
Yes, I agree, Ruth, that it would be great to see it at a local level so that it does feed into that national level. And you'll get my vote if we come to that at a local level.
Well, it's starting in a small way here in
It is.
Bendigo.
It is.
Yeah.
Robin, did you want to say anything to that opening question?
Yes, certainly, I'd love to. Like Professor Ibrahim, I'm pretty glum, but in an ideal world, or even a better world, I look at the Royal Commission report as something that's so comprehensive. It covers legislative, structural, economic, and cultural changes that could bring about a transformation. I think the danger will be in cherry picking among the 148 recommendations, and I'm pretty sure that government is inclined to do that, and to see it as a whole. And I think then we can see a major improvement.
Yes, yes. Thanks, Robin. And I think, Joe reflected that a little bit by saying that, the Commission failed in interconnecting the different recommendations in their final report. And I might just ask Karen, who's from COTA Victoria, whether she had any comments to make to that opening question.
Yes, so for me, it's a significant reduction in the waiting periods for home care, which would have a major impact on outcomes for older people, their carers and family, because older people need to get the home care that they need when they need it so that they can remain in their homes as long as they're able. Currently, this is a major concern in the community that we come across an Navigator project. People are quite shocked that there's long wait periods.
Yes.
That it's a standard expectation. Long wait times often contribute to the decline in health and abilities of people waiting for services, which in turn puts stress on the people, their families, their carers. So if someone is assessed as needing care to maintain their independence in the home, long wait periods have the opposite effect. And
Yes.
Personally, I have seen family members struggling to cope, experiencing a decline in their health while waiting for what they've been assessed and needs to be met. And 2 family members were offered their packages as they went into residential care.
Yeah, yeah.
So reducing waiting periods will lead to better outcomes for older people across all the aged care services, because, people can stay in their homes with the
Yes.
support that they're entitled to.
Yes, yes, I agree. And I think that one of the things that, that Judy referred to, that joint consumer peak organisation statement that came out last week, talks about the waiting periods for home care packages and the enormity of it, and, describes that, in terms of people waiting for home care packages actually die while they're waiting for them. And I think that's a tragedy that has to be addressed. I might just now move to individual panel members and start with some questions. Nick, to you first. One of the things that the Royal Commission stated very strongly is that the aged care system doesn't meet the needs of culturally and linguistically diverse populations. And it gave examples of providers not providing culturally sensitive care. Coming from a Macedonian background, Nick, and from your own experiences, what do you think could be improved to meet the needs of older people from different cultures?
Well, I didn't note it this morning as what would make a difference in this area, and undoubtedly, in my mind, that language is a key to diversity. And well, it can be, according to what I've seen, people can find themselves in a place where their language is not being understood. But to expect the staff or the carers to know several languages is not easy. However, I think that at the point of being admitted to a particular aged care, it should be one of the questions at the top of the list that should be asked, and people should be referred to an appropriate facility where that particular need will be met. I think it might be a case where all too often that's not been addressed. Yeah.
And I think, you know, the thing with language, Nick, is certainly from my experience, is that that impacts on the way people are treated culturally as well. That if the issue of language is addressed, then the cultural sensitivities for that particular person will be addressed as well.
Language is made up of culture.
Yes.
A lot of words that are contained in a language from different happening, historical events that have evolved in a particular country. So it even is related to how we, the meals that we have.
Yes.
And of course, the emotional attachment to family and friends. So without a language, one can find themselves in a very lonely corner.
Yes, yeah, and it's a powerful catalyst for those things that you talked about, family and, you know, and how we understand things and food and all of those things that encapsulate culture, the history and everything.
Gary, I have seen several people in aged care that are very difficult to feed.
Yes.
They simply will not open their mouth.
Yes.
But if you talk to them, and I was often asked to help with this because my mother was a fast eater and I had spare time and I could feed others that were near her in the dining room. So the carers would often come to me and say, could you please feed this one? So if I spoke to their own language, I could get them to open their mouth.
Yes.
I could touch them emotionally.
Yes.
And that's been my experience. Yeah.
Yeah. Great. Okay. Thanks, Nick. I might move to you now, Ruth. And in its report, the Commission expressed concern about access to aged care in rural and regional areas throughout Australia, citing that there was less availability of providers. And I saw this week, I think it was yesterday on the ABC website, that there's an article saying that there is a number of providers are pulling out from regional and rural Australia in terms of aged care. some people might say that, well, why don't we just relocate people in need of residential aged care to the capital cities where there are more providers and services? Some people might say that. So my question to you is, how important is it to provide services in regional and rural locations near where people live? And how well did the Commission address the needs of those living in those areas?
It's very, as an older person, it is important to be where you've lived your years, but it's also important to be near your family. And
yes.
We have a number of people coming here to Bendigo facilities because the family live here. Now, I know that in the remote and rural areas, there's not the choice, but families do like to stay in the farming communities, and residential care in rural and remote areas needs specific financing to make sure that they don't have to close because they don't have the demand on their services.
Yes, yes. And can you just sort of talk a little bit about what your reflections are of the Commission's addressing the needs of people in rural and regional areas?
Well, there needs to be specific funding for rural and remote areas because Australia is a vast country, and you know, let's think the services up in Western Australia need to be looked at differently than even here in Bendigo district, where we have some successful multi-purpose programs that are being very successful in small towns like Inglewood and Rochester, because it means that people can stay in the small towns of under 1,000 people population.
Yes, yes.
I don't know if that answers your question.
Well, it goes to part of it. I suppose that one of the things that I did notice in the recommendations, or and particularly in that joint statement, is that there wasn't a sense that aside from funding, the recommendation for funding, that there was really that the Commission had gone to addressing the needs of rural and regional people in Australia.
You're right, Gary. I had the opportunity to speak when the Commission was here in Bendigo on the complexity of the application process. Because that's what people, and when during lockdown in the September to end of November quarter, my stats, the figures are very low, but I helped 31 families, and those 31 families needed 25 different plans, suggestions, because each one was different.
Yes, yeah.
And this has to be accommodated for, because no one pair of shoes fits all of us.
Yes.
And no protocol fits every situation. And in rural and remote, it's even more important for the individual circumstances to be addressed. And if it takes more money, well, so be it.
Yes, okay. All right. Thanks, Ruth. I now move on to you, Peter. The Commission recognised the unmet needs of people with disability as they age, especially when the aged care system starts to intersect with the National Disability Insurance Scheme. In its final report, it spoke of the lack of equity accessing health services. Growing older and living with a disability obviously adds further complexities. Is it really that hard? And has the Commission sufficiently addressed the needs of people living with a disability?
Wow. Look, I'd obviously have to say no. And my reasoning for that is that the people in the aged care sector are primarily there to provide care needs. They have very little experience of disability and the individual quirks of In my case, I had polio as a child, but there are similarities with other conditions. There are similarities with some of our assistive technology or equipment that we need, but there are some very, very different things happening. I think the best comparison I can draw to this, I've been a volunteer in aged care since my mother dragged me out of bed when I was 16 and said, "You're going to do something." And I could remember in one of the residences, there was a younger person who had cerebral palsy and unable to communicate very well. The language was broken. The poor girl was really left on her own. I became sort of a friendly face that waved at her, but at no time had anyone told me that she was as intelligent as anyone else in the place, if not
Yes.
more intelligent and had greater ability.
Yes.
Over the years, we've learned to acknowledge that people with cerebral palsy are incredibly intelligent and can do anything that anyone else can do. It's just that they can't verbalize it in the way that we can.
Yes.
And I think that's a classic example of where our aged care sector does not accommodate some of these individual needs, whether it's vision impairment, whether it's hearing, whether it's a lack of ability and mobility. And that's something that we need to address, and it needs to be addressed by small organisations that have that expertise.
Yes.
I've had a bit to do with the Motor Neurone Disease Association. They know exactly what they're doing. They know what the forthcoming health conditions are going to be, and they are proactive. Years ago, there was several units. Just about every health condition had a unit. The polio unit, it used to operate at Park Street in South Yarra, right from the 1940s onwards. They had their own clinicians. They had their own ways of providing help to the polio community, and that's why we've thrived under what was, quite horrific conditions of, in my case, I was in a stretcher bed for 2 years. So
Yes.
it's not, that expertise does not sit in the aged care sector. And as people age, we all have loss of function, but many of us have other things that we're bringing to it, and that needs to be addressed individually. In the 71 years I've been alive, I've managed to negotiate all of the challenges of having lived with polio since I was 4. I now live in a fully accessible wheelchair home. It's all set up. It's got its own wet rooms and wet bathrooms, the whole lot should it be needed. I'm very fortunate, and I'm really worried that under the modelling that's been suggested in this report for aged care is that something will go wrong. I'll become too expensive. And in spite of recommendation, whatever it was, 119, that home care funding will be equal to the cost of what it would be at residential. I don't believe that's going to happen. I'll be moved into a barely accessible room in residential care. My wheelchair will become a problem, and it'll be taken off me, and I'll be put in a manual wheelchair where, again, that's another form of restraint.
Yes.
Because that's what we've been doing, and that's what we know how to do well.
Yes.
And I think, as Nick said, the types of restraints that are used by chemical restraints, it's a cheap way of not understaffing.
Yeah. And so, Peter, just from what you're saying there, it would be pretty critical then if the aged care homes can't accommodate you, that you continue to receive a level of funding which enables you to have care and an accessible home in place.
Oh, it's a heck of a lot cheaper too.
Yes.
Aging
Yes.
in place is what we need.
Yes.
Ruth spoke about people living in their community.
Yes.
You don't need a community of 1,000 people to support you. A community of 10's enough.
Yes.
As long as there is regular attention from our medical people, from the other tidying ups we've needed. Many of my friends under the current system they're so underfunded that they're sleeping in their wheelchairs on the weekend because they can't afford a carer out of their funding to put them to bed on the weekend. So they just sleep in a chair. This is inexcusable.
Yeah.
I think the great thing that's come out of this commission is that the public are becoming more aware of the cruelty that's gone on, and we really must keep that flame alight and make sure that we do something about it.
Yes, I agree. Amanda, we might just flick to you now, and maybe I've noticed that there's been a feed of comments coming in the chat. So obviously
Definitely.
people have become more comfortable about that. Are there any themes coming through or questions maybe for the panel?
There was a lot of commentary from some of our attendees about the Council of the Elders wanting to start their own, but then commentary from others wanting to contribute to the terms of reference, particularly to gain an Indigenous perspective, which hasn't really been mentioned as much today. There's some people that are willing to offer to do a flowchart to prioritise the recommendations for the government. So perhaps that's something that we could consider doing, all 100 and whatever there are of them. And then there's some comments starting to come in from our more recent speakers, particularly around the need to change the aged care system to be a rehabilitative and restorative model rather than a medical model, with others commenting that, yes, this is what happens when people become institutionalised.
Yes.
Then comments from Peter's comments around needing to include visitors with disabilities so that there can be that like connection between people. And I probably haven't read the last couple of comments, so my apologies for that.
And I agree that one of the things that we haven't been able to do today in terms of the panel is have representatives from all of those groups that have been mentioned, such as the LGBTIQ population and also the Aboriginal and Torres Strait Islander population. But I recognise that the Commission has addressed some of those populations in their diversity section, and certainly the joint statement talks about that. And I know that there is going to be a conference, I think this weekend or the following weekend, an LGBTIQ conference, which is looking at the issues of aged care, particularly for older people of those populations. All right, so thank you, Peter, and thank you, Amanda. Keep the comments coming in, please. Are we going to, Amanda, just if I can check with you, are we going to provide a summary of the comments at some point in written form?
Yeah, we can do it. We can do a copy of the comments to people and provide those to attendees.
Great,
after
that's fantastic.
The event. You might need to give me till next week, though.
Okay, Karen, you talked a little bit about this at the beginning, but I'm wondering whether you could just tell us a little bit about the program that you coordinate, which is the COTA Victoria's Aged Care Navigators program, and then talk a little bit more about, from your experience and that of the volunteer navigators, what are some of the needs of people accessing aged care?
Okay, so through the Aged Care Navigator program, we assist older people, sometimes their families or carers, to navigate various aspects of the aged care system. So we provide support through information sessions, face-to-face, in individual contact, and also assistance on the line over the phone. And in particular, over the last year, that was really important. As Ruth mentioned, she did quite a significant number in the Bendigo area and surrounding areas. The program involves work at a community level, often in partnership with other organisations, supported by different community representatives and a team of volunteers and navigators. And this program has targeted specific locations for the trial period and taken initial inquiries through a phone line service, which referred through to our project. So that's sort of the overview of how we've been working. provision of very basic information about My Aged Care, you know, where people can start. Some people just don't know where to go to get help. So it's that initial stages through to dealing with more complex needs and addressing a far broader range of issues, which often we might refer on to other organisations. We're also mentoring and supporting people over often a period of time as they work through the system. So there's several times that we might be coming back to support that person. We try to provide some strategies to prepare them for their assessment of needs or what to consider, for example, with their financial aspects. And we're regularly working with some of the other associated services. So the needs of people can be varied, from those just wanting to understand the system. Some people are planning ahead as their needs are changing. Interstate relatives sometimes are trying to assist their families here in Victoria, and especially over COVID restrictions. We had quite a few calls coming through where people were at a loss as how to, because they couldn't get to Victoria, or they just had that really geographical challenges. Sometimes people who've had an initial assessment are lost in the system, or they don't know what's next or where they can get some help. Also, people need access to printed resources as they don't have that online access, online services, and they just need a hard copy of information that we're regularly handing out. There's people who are experiencing difficulties over the long wait periods, and their needs have now changed, and they, so we're supporting them to help them to get a review. People who are daunted by the process of choosing a service provider is common. Where do we go? Where do we start? They get massive lists of providers, don't know what questions to ask, don't know how to sift through to make that decision. And also some people simply need someone to discuss the whole process as they have no family or, family to support them. And we can often become a go-to place where they just need to have a chat. Am I doing the right thing? Is this where I need to go? Because that they are quite isolated in trying to navigate the whole system. So that's just some examples of some of the support that we do provide.
I mean, some of the things you talked about, certainly people want the information in printed format, I think is very common for me from the work that I do as well, that they like to have something to read and to reference later, even if they are using online tools, they still like to have that printed information. And I think that's really important and needs to be included. The other thing I think you talked about, which I think is really important, is that narrative of people who are alone, who don't have family or don't have people close to them who can assist them or advocate for them in terms of navigating the aged care system. And I think that's really important to recognise as well. So in the thing you talked about mentoring, I'm just wondering, in terms of that, if one of the examples you gave is that sometimes a person's care needs will change over the period that they've been waiting. So can you just talk about how you actually manage that and mentor that person to advise, I suppose, that those changes have occurred?
Well, firstly, have they spoken to My Aged Care? So some people sit at home just waiting, thinking it's all going to happen magically.
Yes.
It's encouraging people to be proactive and start by calling My Aged Care, find out where you're at in the process. And just lately we had a session and we had one of the assessment officers supporting us, and with that person, we sat down at the end and she actually, with the person's permission, looked up her file on My Aged Care, and she was caring for her husband and thought that he was getting services. And then and that she was on a wait list. Turned out her husband had never been assessed, and the services actually were linked to her, and she'd been moved across in a big lump when the whole system changed over, and was not getting services she'd been approved for. So both of them actually needed a review. So it's trying to find out the start point for that person. Where do they go? Who do they talk to? Because they can get lost along the way. And she was quite shocked, you know, that her husband wasn't even in the system. Because so you have to find out where the person's at and then take them on the right pathway.
Sure. And so, Karen, if someone wanted to get in contact with you to be considered to be, to be assisted in that aged care navigation, how would they do that?
Well, one main way is through our phone line service here at COTA. It's a 1300 1350 90.
Yeah.
And through that, our staff pick up those inquiries.
Yes.
About, somebody needing support and refer them through to us.
Yes.
And sometimes there's other networks that we've established through some of our trials.
Right.
Ruth is our network in Bendigo, obviously.
Yes.
So it's a lot of word of mouth, but the 1300 line is a good start place.
Okay, great. Thank you for that. And I'll just say that number again. It's 1300 135 090. And the telephone number is in the chat if you didn't get it. And just a reminder that if any of this is distressing for you, that we do have a counsellor in attendance, and her name is Janet, and you can contact her directly on 8470 1874. Okay, I'll come to you now, Robin. You're an aged care advocate. Why are you so personally invested in this issue?
I see it as a human rights issue.
Right.
And my interest in aged care has been developed from a very young age. As a student nurse, I loved working in the geriatric ward, unlike some of my peers. It was an incredible experience to meet so many wise and lovely older people, because of course in those days, I'm 75, so we're talking a long, long time ago, there weren't many aged care homes. So the geriatric ward was often where people ended up.
Yes.
Leaping right ahead, having worked in the community and health sectors and occasionally government, I've come into contact with aged care issues in many different roles. I drafted the ACT's first healthy ageing policy, and it was quite apparent then, when I was doing my research, that government would need to face up to a rapid growth in the aged population.
Yes.
And a decline in the dependency ratio. So my observation is that now we've reached a crisis in aged care. What have governments done to put things in place to manage it better? My greatest horror and shame came in a protracted work trip to rural and remote Indigenous communities, and to see, particularly in a remote setting, how Aboriginal people who are old and don't happen to have families that are able to care for them well are treated without access to almost any services, let alone poor services, locked in compounds overnight. That was the aged care system within those communities. And so I just think it's unjust. Forget about a rights-based approach. We need a human rights approach to everything pertaining to ageing and the need for care. And I guess that's what drives me.
great. And I noticed you said that you, you know, were a part of formulating the healthy aging policy. How's that going for you individually?
Sorry, whether aging is a healthy experience for me?
Yes.
Aging's a very healthy experience for me, but at 75, I do realise that at some stage I will need access to care, whether that's provided by family or the system remains to be seen.
Yes.
But one thing I don't want to do is age in a society that knows the price of everything but the value of nothing.
Yes.
And there's such enormous value that can be found in proper treatment of people as they age.
Yes. So, as an advocate, how has the Commission addressed some of your concerns, and what do you think is missing?
Whether it was the role or not of the Commission, I think the biggest missing link is the cultural change. What I find in my current advocacy role is that people, when you approach them, community members, younger people, even my grandsons, say, oh yes, well, the poor old things have to be looked after properly. But when it comes to actually paying for that, it becomes a totally different response.
Yes.
And I think that the Royal Commission report needed to focus on cultural change more and how we can bring that about, how we can actually reduce or abolish ageism in our society, because it's very rife, how to finance a brand new system which brings about a transformation in older people's lives.
Yes.
Hasn't been dealt with in enough detail, I think. Even though the big picture is duly reported, I think government will avoid that, and there's already indication that that is going to happen.
Yes.
In Scott Morrison's response, when he said, oh, well, there'll be no levy, I mean, that was his only real direct response to the Royal Commission report.
Yes.
That's very, very disappointing.
Yes, I agree. I think it is very disappointing. And, you know, it goes against the grain of what you said at the beginning about price and value, you know, that he focused purely on the price and not the value, which I think is really disappointing. How do you think we'd go about getting the cultural change?
Well, that's one of the things that I guess I focus on.
Yeah.
It's not we poor old things. It's about being valued members of society as elders. I think other cultures get it a lot better, where there's huge value placed on the wisdom and contribution of the elders, Aboriginal communities being one of them. I think that it's our biggest job to bring about a change in society's attitudes to aging. It's not a horrible thing to do, age. It's a rather lovely thing. I think we have to present much more positive images about aging in the media. Look at the media at the moment when it does bother to touch on the Aged Care Royal Commission, and that's another disappointing thing. The caravan has moved on, and now we're all about vaccinations.
Yes.
But we have to get much more positive images of aging out there. And certainly that's what I try to do.
Yes. Yeah. I think it is a challenge. I think that, you know, that in terms of the work I do in elder abuse, the driver is ageism. And it's a challenge to raise that and raise awareness to counteract that, not only amongst sort of the younger population or the middle-aged population, but also for people who are getting older. because there is a lot of internalized ageism as well. And so that promotion of, aging in a healthier way really counteracts that negative aspect of aging that people might be hanging on to.
One of the communities that I'm involved with is exercise classes at a council-owned leisure centre.
Right.
And I'd say that probably 90% of the groups that I intermingle in are older people, some right into their 90s.
Yes.
And we have such fun, and it's such a positive experience to be involved in that.
Yes.
And it's made me think, how do we change the narrative?
Yes.
And I'll say again, we have to promote the positiveness of aging and the benefits. I love being retired. I love my work, but hell, I love being retired. And so far I'm very well, but I'll be ready to deal with it if I'm not so well later on.
Yes.
I have a very supportive family, and that's another key, I think, to promote the role of family, as so many, as Nick will tell you, because I do know Nick. Hi, Nick. There are so many higher values in various ethnic communities towards their aged family members.
Yes. Okay. I might just flick to Amanda just to give us the final comments, and then what I'm going to do is I'm going to hand over to Alexia and Amanda to do a roundup, just because I know we're sort of factoring in time here.
Yep.
So Amanda, any comments or particular themes that are coming through?
There's lots. I think, we might have all started out with a glum overview of what might have been occurring. But from that, we are rallying lots of ideas in the chat and lots of encouragement from particular attendees. So thank you for your positive comments. There's a comment there that the Navigators program that Karen spoke about could be promoted in doctors' offices with flyers. Comments around that self-managed home care is not promoted by My Aged Care, and some people who have switched to having a self-managed fund and think it's the best thing that they ever did because the providers can't take all the money for that administrative component. Comment from the Omni group. COTA's got a Old Men's New Ideas groups throughout Victoria, and we're glad to have them along today, that they are very involved in various groups to stay connected, active and out of residential aged care. Comments around allied health being crucial, occupational health and others. Encouragement for ground up action. Let's not be discouraged. Don't let the government off the hook. Don't let them replace a council of elders. The panel has given us some great examples, and thank you very much. A suggested book, The Aging Parent by Brian Hurd, to help people to prepare, the younger generations to prepare. And that was a nice segue for people encouraging intergenerational bridges, so that they realise we know a thing or two, but actually it goes both ways, doesn't it? It's just about creating a broader understanding. Comment around the older people home for 4-year-olds being a good starting point. Some people think this is a huge challenge to tackle, that the system lacks respect for older people, and that it's more about the need to make money for providers. And I know that there's a lot of comments that have popped up. I can't read and at the same time. So feel free to add to that, Gary.
Good on you. And thanks for summarising that, Amanda. It's obvious that people want to contribute to this discussion, and certainly COTA Victoria wants to hear from people at different levels of the community as well. I'm going to, that concludes our panel discussion. Thank you to Peter and Nick and Robin and Ruth and Karen for being courageous and being on the panel. I think it's always quite admirable to have people put their hands up and be on panels of this nature to stimulate discussion and to stimulate further action. And certainly that's what's happened as a result of today, and certainly it's reflected in the comments. I am going to hand over now to Alexia and Amanda and leave the forum. I would like to thank you all for participating. I think it's made for a very rich discussion, and I would particularly like to thank our two keynote speakers at the beginning, Judy and Joe, for contributing to the discussion as well. Thank you very much, and I'll now hand over to Amanda and Alexia.